All right. All right. So welcome, ladies and gentlemen, and thank you for joining us for the 7th edition of the Fireside Chat. My name is Garrett McLaughlin. For those of you who are new to this series, the Fireside Chat is a conversational webinar where we connect with some of the top professionals in the running industry. This week, we have David Jennings, who is a physical therapist in Nashville, Tennessee. Before we get started, let me cover a few quick housekeeping items. First, do me a favor, silence any technology around you to really make sure you get the most from this chat. Second, I highly recommend asking questions. Of course, there will be specific items that we will cover as was outlined in the registration, but you're welcome to ask anything at any time to make sure, again, you're getting the most from this chat. Feel free to drop a question in the chat box or at now or at any point throughout the chat if something's on your mind. Lastly, if you cannot stay for the entire chat for whatever reason, or you just want to reflect back on this content at a later time, I will be sending the replay of this to you tomorrow at 11 a.m. Eastern time. So make sure to check your email and especially the spam folder since it can sometimes end up in there. So without further ado, David, thank you for joining us in the Fireside Chat. How's everything going this afternoon?
It's good. Thanks for having me, Garrett. It's a lot nicer here in Nashville than it was last week. So it's nice to be able to get out and enjoy the sun and the melting snow.
Yeah, for sure. I've heard you guys had a tough week, but I saw yesterday was about 50, 60 degrees though. So it turned around pretty quickly.
Yeah, all that snow, I guess we got about 4 inches of snow. All that snow is about gone now. So it was a nice week of winter.
Right. I gotta love that Nashville weather. You never know what you're gonna get.
So yeah, thanks Garrett. Like Garrett said, my name is David Jennings. I'm a local physical therapist here in Nashville. I work in a physician's office in Franklin, Tennessee, National Regenerative Orthopedics. I'm a board certified specialist in sports physical therapy. So I've worked with a lot of runners from LSU to Vanderbilt with their cross country and track teams, and then went to PT school. And then did a sports physical therapy residency. And I've been working with a lot of runners in the Nashville and Franklin area ever since.
Awesome. That's good to hear. And so where are you from originally?
I'm originally from Iowa. So this 4 inches of snow is nothing new to me.
I know. Yeah, seriously. I heard Iowa gets pretty tough in the winter.
Yeah.
So let's get into the content here. I want to talk about improving mobility for runners. So just to get us started, kind of give us an idea of what does mobility actually mean? Because I think a lot of different things, we're throwing around different terminology from mobility to flexibility to stretching. Can you just define that for us?
So I feel like mobility isn't just having range of motion, but the ability to control it. So it's the ability to move freely. We don't want to be Gumby. We also don't want to be C3PO. We kind of want to have a good control of that range of motion throughout, so you can do what you want to be able to do. And I think a lot of misconceptions are that that mobility is strictly related to just muscle tightness, and that's not always true. There's a lot of different things that can actually create and restrict mobility, and that can come from the joint itself, any arthritis, so like any cartilage in there. It can come from tendons, it can come from ligaments, it can come from the joint capsule, and also from muscles. It come from a restricted mobility can come from several different ways too. It can come from, as we age, we aren't as mobile. I think we can all feel that. Postures are a big one. If you are always hunched over your computer, it's going to be really difficult for you to extend back up. And if you're always sitting, your hips are going to not like coming into a hip extension position. Repetitive motions are a big one. We see this a lot with our baseball pitchers, and you'll see maybe if anybody has got a kid or a friend who's a baseball pitcher, they'll notice that their throwing shoulder may have more restricted internal rotation range of motion. And that's not just because of they were born that way. It's just they are repeatedly doing one motion and need more range of motion in another way. And that's very common for us to see as well. And again, and then also what we can see is we can see restricted range of motion after surgery, and then injury before and or after. There's all sorts of other things that can cause it as well.
So as I sit here and look at Simone Biles do this on the balance beam, and wonder to myself, is more mobility always the answer? Again, a lot of people are searching for more flexibility, more mobility, but does more necessarily always mean better?
I don't think so. I think you just need to have the range of motion to be able to do what you want to be able to do. I don't need as much range of motion as Simone Biles does. I think there's a top 0.1% of gymnasts need as much range of motion as Simone Biles does. And I think that trying to go down the rabbit hole of I just need more and more and more can set us up for other issues as well. So, and that comes back to just being able to control the range of motion, not only just having it.
Right. That's awesome. So what are some of the things that are typically associated with being immobile or lacking that mobility?
So we can focus on just lower extremity stuff, but the big ones that we see with runners are plantar fasciitis, and with that you're gonna see restrictions in dorsiflexion range of motion and even in the toe mobility. Achilles tendon issues, again, that comes down to dorsiflexion ankle mobility, and even hip mobility and lower back mobility play a role into that as well. If you have tight hamstrings, that can set you up for hamstring strain issues or neural tension issues. Lower back pain's a big one. If you have any restrictions in your mobility of your hip or of your thoracic spine or your ankles, pretty much anything can cause issues in lower back pain, and that's why we want to address those things as we find them in PT. Ankle sprains, there's a big documented correlation with restricted ankle dorsiflexion mobility, so your ability to kind of squat down. It comes a lot with ankle sprains. And then patellofemoral pain, which is just that vague pain at the front of your knee. There's a big one with that. And quad length, hip length, or hip mobility, hamstring length, ankle, like it all comes into it. So there's a lot of different issues that we see that can be related back to mobility issues. And then the next logical question is, well, if I'm tight, well, what can we do to fix that? Well, in PT, we have a couple of different ways that we can do that. And one of those is joint mobilization. So if you've ever gone to physical therapy and had the therapist is trying to move the joint back and forth to loosen it up, and that's going to help improve that joint mobility. And there's a lot of documentation of that shows that that's beneficial. Foam rolling is another big one that we see in our outpatient population. The difficulty with foam rolling is it's not really as beneficial as we may think it is. The outcomes and the improvement from foam rolling in itself aren't that great. For doing it for about 1.5 minutes or 2 minutes, we can only see a couple of degrees of improvement in ankle range of motion and hamstring flexibility, and the results or the outcome only lasts for about 10 minutes. So you have a short window of time that you can use that foam rolling to improve your mobility. It may make us feel better. Well, I guess that's up for discussion on how much better it makes you feel while you're doing it, but it can help, but it's short-lived. And then the other ones that we see are stretching. And there's a lot of controversy, in my opinion, about stretching and whether it's effective or not to accomplish what we want it to accomplish. If you dive into the research, what you find is that stretching in and itself isn't as effective as we may think it is. We're only gaining a few degrees if we want to stretch for a few minutes a day, or for over 6 weeks, you're only going to gain about 5 degrees of ankle dorsiflexion range of motion. So if you are spending 5 minutes a day over 6 weeks trying to stretch out your calves, you're only going to gain about 5 degrees of range of motion, and that'd be about the same as doing it once. So is it really beneficial to spend your time doing that? It's the question. You can get a short-term improvement in that range of motion, but it only lasts for about 20 minutes. And if you're not going to use that range of motion, it's not going to last. We also see that stretching can be beneficial in kind of even improving the range of motion in the opposite side if we're going to do your hamstring stretching. But again, those gains are short-lived. And when we talk about stretching, we're not actually stretching the muscle. There's no change in the muscle length. We're not really stretching the tendon that it goes from the muscle to the bone, because there's no change in that length. We're not reducing the muscle activity. Muscles work from nerves that control that muscle, and there's no change in that. So really the only thing that we're improving is your ability to tolerate the stretch. There's a lot of research out there that shows that it's not really doing anything to the muscle itself. It's just improving your ability to tolerate it.
Interesting. So I just want to ask you a quick question here, and back on this slide. One thing that it sounded like was a common theme as you talked about a lot of these different injuries. Some of the areas that you mentioned that you want to work on improving mobility at are not the areas that we're experiencing pain. So you said lower back, but then you said hips and thoracic spine. You said patellofemoral, ankle, hips. So if we're feeling a symptom of, again, which might be just we're feeling tightness, we're perceiving tightness, and we're working on stretching that one center, like my hamstring feels tight, I'm going to stretch that hamstring. It might not actually be the hamstring that's the issue. Is that correct?
Right. And there's a concept in physical therapy that's called regional interdependence. And it basically talks about how mobility at one joint can affect mobility at somewhere else. So like any hip mobility issues can affect your lower back or your ankle. So we want to make sure that we're identifying the correct place to really target that. And I see that a lot in physical therapy. And I'll see individuals with plantar fasciitis that have really strong and mobile ankles, but their issue is actually coming from their hip because when they're trying to run or squat or walk, they're not getting enough hip mobility, or maybe it's coming from the lower back and they're not getting enough lumbar extension, and that's causing issues at their ankle, or maybe they're even just getting pain as it travels down their sciatic nerve. There's a lot of different things we want to be able to address with that. And on the back end of this, I think we're going to talk about some easy self checks that we can give to people, so that way they're identifying some appropriate spots.
Pretty awesome. That sounds good. And so when it comes to looking at muscle tightness, what is the difference here between if a muscle just feels stiff, is stiff, or muscle actually is shortened and you have trouble going through the range of motion?
So this is important. A stiff muscle is a muscle that's just has an issue with stretching. So there's a larger force that's required to get it through that range of motion. And a short muscle is one that's actually gotten shorter, where the tendon and the muscle itself has shortened. And you'll see that primarily after like a casting or a booting or something where you're in it for a long period of time, where the muscle will adapt to that shortened range of motion. What I tend to see more often is stiff muscles in physical therapy, where the muscle just has that resistance to a stretch. And there can be a couple of different reasons for that, one of which is something we call reciprocal inhibition. And the basic concept of that is our body works like a seesaw. Or like a tug of war, if one muscle's turned on, the other muscle that opposes it is going to be turned off. So it's going to not be as engaged. So if the on muscle or if one muscle's turned on, it's going to feel tighter, because that's how you're gaining some of the stability. And we have an idea of why that might be in individuals with some low back pain. Individuals with low back pain tend to use their hamstrings and hip flexors to try and stabilize the spine more. So those muscles will actually feel like they're a lot tighter than they really are. Whereas if we were to come in and do some strengthening exercises to maybe the glutes or the lower abdominals, we wouldn't even need to stretch the hip flexors or the hamstrings, because we are improving the balance, we're improving the seesaw of the lower extremities, so that we're not having that tightness there.
That's interesting. So back to, we need to make sure we're looking at multiple areas and not just what's being felt as tight, because it might not be actually the right thing to address.
Right, exactly. And there's a test that I've used before, and is a fun little trick if you have people with some hamstring tightness, where if you have them lay on their back and ask them to raise their leg up, they'll feel like their hamstring is really tight. But if you teach them how to engage their core and then perform the same exact motion, their range of motion doubles, and they're like, I don't even feel any tightness. And we didn't change anything. We didn't change the length of their hamstring. We didn't change anything like that. We just taught them how to engage the appropriate muscles at the appropriate time, and it changed the relative stiffness of that muscle.
Oh, that's awesome. So I think a perfect segue here, and I'm kind of interested in the order of how things should be done to create that end goal of either better mobility, less perception of tightness. Is this a specific, do you think you need to go in a certain order? Because I see a lot of people sometimes go through a warm up and then they jump on the foam roller, or like and I'm kind of looking at like, is that really going to be the best order of operations to feel better for that workout or for that run? So there's certain things we need to do to address and in specific order to do so.
I I think the jury's probably still out on that one. I'm of the opinion on some stuff that if it makes you feel better, go ahead and do it. It's probably not gonna to hurt you, but I think there's a couple of key concepts and bullet points that we want to touch on in preparation for movement. And I think in improving mobility in itself. And I think one of the things that we need to do on the front end is always make sure that we're trying to reduce the resting tone of the muscle. And I think how we address that is you can do that with self-massage, the hypervolt guns, or the self-massaging percussive guns can be a great way to do that as well. Those have shown to be very beneficial. Foam rolling, it helps us feel better. And I don't know about you, Garrett, but when I do use the foam roller, I do feel like I have a little bit more mobility immediately after. So I like to use that to help reduce the resting tone of the muscle, but with the understanding that it's not going to give me my long-term improvement in range of motion, but it can help me feel a little bit better. And then I'll try to follow it up with some kind of dynamic warm-up where I'm working through a range of motion, getting my muscles to start engaging. And I think that stretching and a dynamic warm-up can be a beneficial thing to do that, where you're working through that big range of motion and teaching your stabilizing muscles to work at the right time. One thing that I also try to teach a lot of people in my physical therapy is using some self mobilizations with some thick bands can be beneficial in getting that extra degree of range of motion, or those extra few degrees of range of motion in your ankle, in your hip, just even in your shoulder to help with overhead flexion and things like that, just to be able to manage these issues on your own after people come out of physical therapy. So I think there's a stepwise progression in trying to reduce the resting tone, and those can be some beneficial ways to do it. Going back to that dynamic warm-up, I think one of the most beneficial things about that dynamic warm-up versus just static stretching or forward bends to stretch out your hamstring is it does get the core muscles and the stabilizing muscles active. And those have been, once you can learn how to use that range of motion by activating those small little muscles, it will definitely help improve your motor control through that full range of motion. And then kind of the final piece of that puzzle is you want to make sure that if you really want to gain improvements in mobility and improvements in range of motion, you just can't stop at the first two. You can't do your foam rolling and your stretching and call it a day. We've shown that there's studies out there that have shown that over 6 weeks of stretching for 5 minutes a day, you don't gain anything. I can gain 20 degrees of dorsiflexion range of motion by sticking a dry needle in somebody's gastroc in 5 minutes, and it'll last for 3 months, versus having somebody stretch for 5 minutes a day for 6 weeks. And the outcome is just going to be so much better. But the problem with that is if we gain that range of motion in the short term, we have to be able to use it. So we need to load it. So if we gain 20 degrees of range of motion in somebody's ankle, I'm going to give them squats. I'm going to give them lunges. I'm going to give them duck walks or something where they have to learn how to use that range of motion and use it functionally. If I get that range of motion just to document it on my notes, then it doesn't do that person any good, and they're just going to continue to have other issues. And the other thing, we also have to make sure we're loading things appropriately. So we already talked about reciprocal inhibition, and if one muscle's on, we want to turn on the off muscle. So we want to make sure that we get our seesaw back in balance. If we have an example of that would be if somebody has tight pecs, we want to try and strengthen up the scapular retractors, the muscles in the mid back. If somebody has tight hip flexors, we want to make sure we're strengthening up the gluteal muscles. If somebody has a tight calf, we want to try and strengthen up their anterior tibialis muscles, so that way that the muscles feel comfortable using or comfortable controlling that range of motion throughout the whole range.
So if someone's goal is to improve mobility in some way, do you think it's necessary? They haven't been doing anything. They've been foam rolling, stretching by itself. They need to start adding some additional. Is it necessarily like a strength training component, or is it just a handful of body weight exercises that they just follow up their stretching and mobility drills with? Like how far?
I think it can be a combination of both. I think some body weight exercises can be beneficial, depending on what the goal is. But ultimately, I think trying to put some kind of extra load on top of it is probably going to lead to a longer term improvement. And again, there's nothing wrong with using the foam roller or stretching or banded mobs, but because it helps us do feel better, but understand that the goal of it may not just be to improve your range of motion. It's actually just to make you feel a little bit better and feel more mobile, but it may not change your actual documented range of motion.
Interesting. That's interesting. Okay. And so from a running standpoint, could you just kind of educate us a little bit on what are the key areas we need to be thinking about from a running standpoint? Should we be stretching and mobilizing everything, or are there certain joints and ranges of motion that we need to prioritize?
So here I just put in a couple of the main ones. So your hip, your knee, and your ankle. I think as a runner, everything needs to be addressed to a certain degree. Like for example, you are getting shoulder motion forward and back that is necessary to be able to balance the leg motions. And then there's some thoracic spine rotational things that need to happen. There's lumbar flexion motions that need to happen, but those aren't very big. And we're talking 10 to 15 degrees of thoracic rotation from side to side. And we're talking maybe, I don't know, 50 degrees of shoulder flexion and extension total. So it's not a big range of motion. As long as you don't have frozen shoulder, you probably have that available in your shoulder. So what we'll focus on is just the hip, knee, and the ankle. And I think a key thing is knowing that with running versus walking, there's really no difference in the range of motion that you need from one to the other. If you can walk without restriction, you can probably run without restriction. And if you feel tight, it's not because you have restricted range of motion. It's probably just because you have a difficulty in controlling that range of motion at such a fast speed. So that's more of a motor control issue instead of a tightness, range of motion, stiffness issue. And those things get treated differently. We can treat both of them at the same time, but they get treated differently and the goal is a little bit different. So with hip, so hip extension in running, we only need about 20 degrees, which isn't a lot, considering how far it seems like your hip is actually going. But there's some lumbar motions some lower back motions that are helping to contribute to that. For hip flexion, we're only going up to about 40 degrees of hip flexion. To be able to sit into a low chair, you're already at 90 degrees. So if you can sit on your couch, you probably have enough hip flexion range of motion to be able to run. There are some other range of motions for like internal rotation and adduction that everybody has. One thing that can be an issue with running, though, with hip flexion and hip extension is your ability to control one forward and one back. So if one hip is in extension, the other one's going to be in flexion. So if one is behind you, the other one's going to be in front of you. Otherwise, you're going to fall flat on your face. So being able to control that range of motion on both sides is important. And again, that comes back to a motor control issue. At the knee, if you have full knee extension and you can bend it to about 90 degrees or 100 degrees of knee flexion, you have enough range of motion to be able to run. It might be difficult to control it through that full range of motion, but you have it there. And most of the time, we don't even get into full knee extension. We're stopping at about 15 to 10 degrees of knee extension. Otherwise, we'd be pounding on the joint a lot instead of using the muscles. And in the ankle, we talk a lot in physical therapy about achieving neutral dorsiflexion range of motion or gaining enough as we do, but our ankle actually goes into about 25 degrees of dorsiflexion, I think, for a heel striker. So that's a lot more than a lot of people have, and that's why we focus on it so much. But the pointing or the plantar flexion motion, like if you're pressing down on the gas, isn't nearly as much as a normal person's range of motion. Just about everybody has 40 to 50 degrees of plantar flexion range of motion, and that becomes important during the push-off phase of when you're trying to get that last little bit at the end of your stance phase.
Awesome. So for the most part, I think interesting. You said walking and running, very similar ranges of motion. So if someone doesn't notice any limitation, tightness, lack of mobility walking, you think most likely there's something else that's just breaking down as they get to those faster speeds with the higher impacts, if they're having
I
pain
agree.
or tightness.
I do. And I think that's where like where we talked about before, loading it, using the more muscles that are producing more force and maybe even at a faster speed can be more beneficial than just stretching and doing some light foam rolling and some band work to improve it. You need to teach your body how important it is to be able to generate force quickly. And that's where I think our issues come in, is being able to control that, generate large amounts of force over a short amount of time for a long duration.
Mm-hmm.
I think that's where a lot of those restrictions and those mobility issues will tend to pop up. It's just because people that are maybe more prone to injury aren't doing the amount of strength training and power training and plyometric training that may be required to be able to keep up that amount of force and high level of activity for such a long duration.
Interesting. And so I guess with that, it kind of changing, gone off track here a little bit. Do you recommend most runners incorporate some kind of strength training, power training, plyometrics, or is that specific to the person just based on their foundation?
I guess we are going a little bit off track from the mobility issue, but I think it's a good segue. I do. I think, especially with what I saw in the gym with you working with your runners, I think a lot of it is great. And getting people squatting, getting them understanding that sometimes you just need to move more weight than you think you do, because you need to be able to really strengthen up those muscles and get them to learn how to eccentrically control, to generate force, to control the landing. And you just can't do that with just body weight squats and body weight lunges all the time. Those are great exercises, and I give them to a lot of different people, but I try to make sure that all of the runners that I work with understand that pushing more weight can be more beneficial, and you can have a longer term improvement from physical therapy and from all the work that we're doing inside the clinic if you supplement all of that with your strength training on the back end.
Okay. Yeah, sorry, I threw a little curveball at you, but I thought it would just be good to understand that a little bit more. Now, from a self-assessment standpoint, obviously you mentioned ankles, and you said that ankles specifically, we're going through more range of motion than most people have. What's a good way to self-assess that?
So this right here is a great way to do that. And what essentially all you're doing is you're just going up to a wall, and you're going to set a ruler or something about 4 to 5 inches away from the wall. And you're going to try and keep your heel down as you try to touch your knee to the wall. That's a great way to be able to test that. This is a little bit more range of motion than we would cue people in to have while they're squatting or lunging or anything like that. But if you have that range of motion available, we can learn how to control it through that full range of motion. It's just a great, easy way to assess that. And in physical therapy, with seeing a lot of runners and seeing how many knee and ankle and foot issues that we have, this is the first thing that we'll check. We'll always try to check this, and this is some of the first exercises that we give people, is trying to improve that range of motion, that flexibility, that mobility of the ankle itself, because you can improve a lot of different things. Sometimes it's just low-hanging fruit. Let's get your ankle mobility better, and sometimes that plantar fascia pain or that first toe pain or that back of the knee pain or something like that will just magically disappear.
And if we look down or up at the hips, some other important self-assessment, obviously looking at hip extension here, I can see what you mentioned was really important for running, for pushing off, but could you talk through that a little bit for us?
Yeah, one of the things that I like to check with hip mobility is how close we can get people's knees up to their chest. This is an easy one to check. Can also be a great stretch if you're tight in it. This will give us our hip flexion range of motion. And the good thing about this position right here is it's a squat position. So if you can't get into this position laying on your back, you can't get into it when you're standing up with a barbell on your back either. So if you are trying to do heavy squats and you can't get into this position, don't do it. Like improve your hip flexion mobility first before you try and just pound it in there. Or you can modify your squat to maybe not go as deep. But I think this is a great mobility assessment to be able to check that. As far as your hip extension range of motion, that's just the opposite. You're going to lie in your stomach and you're going to try and lift your leg up. And the goal here was essentially to be able to lift this individual, he's trying to lift his left leg, and you want to be able to try and lift your left knee a little bit over your right knee. So be able to kind of stick a dowel rod or something in between them. And that'll give us about 15 to 20 degrees of hip extension. And that's important. But the key to this one, probably going a little bit too much into the weeds of this, but we want to make sure that when you're doing this one, you're not just extending from your back. You're not just trying to arch your back to get that range of motion. You want to make sure that it's just coming from your hip.
Interesting. I think it's funny you say that. I mean, I see a lot of people, especially being in a gym setting, when you have exercises like bird dog, donkey kicks, and you're looking at them actively extend the hip, and then all of that's going right into the lower back. Is that something you commonly see? If the hip is limited, the lower back's going to take the brunt of it?
Absolutely. And I think that comes back to what we were talking about with hamstring tightness and hip flexor tightness, that if you don't have the abdominal, like the lower abdominal and the deep lumbar extensor strength to be able to control that, those muscles are reflexively going to just do more of the work. And because they're doing more of the work, they're also going to feel like they're the tightest, because that's what can happen is when we start to use a muscle, it starts to feel tight.
Awesome. Okay, so let's as we start to wrap up, get to questions here. If any of you that are watching right now, we have a good crowd here from Monday afternoon, about 25 people, which is awesome. So if you have any questions as we start to wrap up, feel free to drop them in the chat, and I'll make sure to ask David those as we get to the Q&A. So David, if people have questions for you specifically, I always say this, and we're looking at the screen with your contact information, but is there a way for them to best get in touch with you?
Yeah, so this is my email. It's davidj@performancepttn.com, or my cell phone, 615-878-7595. Can text, call, email, any and all of the above.
And you have two young kids, so it's okay to call at any hours, right?
Absolutely. Absolutely. Yeah. We got 4 3/4 and 1 3/4. They keep us busy.
Awesome. Have they enjoyed the snow at least?
They loved it. They loved it. We don't have any sleds. I'm a little ashamed to say that I'm from Iowa and I don't have a sled. I also don't have a shovel. After living in Nashville and only needing it like twice, but so we just used some cookie sheets.
Oh, that's awesome.
They loved it.
Get resourceful in the South.
Yeah.
So I'm going to I have a few questions written here just from when people signed up for the chat. People wrote in just the area that they were interested in learning about. So just gonna get the Q&A kicked off here. If anyone else has questions, I see a few coming in. Feel free to drop them in there. So Nick, who's actually a pretty good triathlete and runner down in the Nashville area, mobility exercises to do pre-run. Are there certain things to think about when it comes to mobility stretching before activity, before running, as opposed to just randomly throughout your day?
I think that comes back to some sort of dynamic warm-up. Doing a couple of the exercises that I really like to start with before I run, and I've just found this to be beneficial for me, are walking RDLs, walking quad stretches, walking like a hip flexor with a stretch with a twist. It's called another good stretch that may be beneficial for a lot of people was I've heard it been called a GOAT stretch, like greatest of all time stretch, where essentially you're doing a walking lunge, bending forward, and then standing back up, like with your arms over your head. And maybe Garrett has a better way to describe that stretch, but that's a very good one that can target a lot of different things. And then I also think that if you follow that dynamic warm up with some activation exercises, like monster walks or side steps, or even just a couple of nice small little plyo jumps, whether it's a broad jump or like a box jump, those can also be beneficial just to wake those muscles up.
Awesome. That's awesome. And I think especially right with the demands of running, sometimes I always see a lot of people, it's like a big disconnect. We're doing static stretching and then all of a sudden we jump into the high impacts of running. It's this big gray area. So that sounds like it would bridge the gap pretty well too.
Yeah, I found that to just be beneficial for me and some of the people I've worked with, just to encourage them to do some sort of dynamic warm up to get everything working.
Awesome. Mary Lynn asked, what is dry needling? I know you mentioned it earlier with the interventions.
That is a great question. I'm glad somebody asked that. So dry needling is a technique where we take a very thin needle and insert it directly into the muscle to get that muscle to relax. It works at the neurological level to basically tell that muscle to relax. So tight muscles sometimes have trigger points. What we find where most people will notice these are like in your upper trap muscle, especially now that everybody's working remotely. And those tender spots in there are called trigger points. What we can do is we can take that needle and stick it directly into that muscle to get that muscle to relax. And it's amazing at how quickly it can work and how long the results can last just from a couple of needle sticks. Like I've had patients who've had 10 years of headaches, stuck some needles in the muscles in and around their neck, and it took their headaches away. One patient in particular, and all of those headaches were just coming from muscle tightness. They weren't coming from the joints, they weren't migraines, they were just coming from the muscle tightness. I had one patient in particular that couldn't wear earrings. She couldn't wear her hair in a ponytail because she was having so much headaches. I did 2 sessions of dry needling, and she went back to being able to wear earrings and put her hair in a ponytail. And, it can be great at improving range of motion in the lower extremity as well. I was having a patient that was having difficulty getting his knee flexion range of motion back after a knee surgery. So I needled his quad, and we gained 20 degrees of knee flexion range of motion back instantly, and I didn't have to touch it again. And it's just a great technique that can improve so much so quickly if you can tolerate how uncomfortable it can be.
I was going to say, you're bragging about the benefits and then also saying I'm putting a needle in someone's muscle. So probably pretty uncomfortable depending on the area to some people, but
yeah, it can be uncomfortable, and that soreness can last for 12 to 24 hours. But usually after that, people are like, I'm so glad I did that.
Then they continue to pay you to torture them with needles. So Marlene asked 2 questions, Marlene and Carol. Is there any benefit to stretching after a run? And then Carol also says, so basically I should still stretch post race walking. So what is your viewpoint on stretching kind of as a cool down?
I think it's beneficial. I do it. And I think the reason why it's beneficial comes back to the fact that repetitive motions, and that's what walking and running are repetitive motions. Repetitive motions have been shown to reduce your range of motion acutely, which means right away, and that reduced range of motion can also last. And that's what I was trying to talk about with the baseball pitchers, is you'll see that. So if you come in and you do your stretching or your foam rolling after your run, it can have a benefit in reducing in the tightness in the muscle itself, and how tight you feel long term after that. So yes, I think it is beneficial to still do those things after you're walking or you run.
And to expand on that, is what we're looking for at that point to improve range of motion beyond our baseline, or are we trying to restore and get back to?
I think it's going to be more of a restorative effect more so than an improvement.
Okay. Yeah, I was always curious about that because I see some people that finish, and I just didn't know the answer. Some people that finish harder, maybe speed workouts, those types of things, are really pushing themselves, taxing their body. And I was always curious, how much static stretching do we want to do after if we've broken down the tissue to some degree? So does that matter, the intensity based on?
I always tell people we don't need to win the stretching competition. We're just looking for a nice, easy stretch to help it reduce that resting tension that's in it, but we don't need to go 100% on your stretches.
Awesome. So last 2 questions here. Barbara asked, is there any benefit to do myofascial stretching?
Absolutely. You're going to run into some controversy about what that exactly is. I mean, in my opinion, you can't treat the muscle without also treating the fascia.
Mhm.
They're too interconnected to be able to um, differentiate. And I think foam rolling and soft tissue work, the hypervolt are all going to address that. Dry needling even addresses that. And so, yeah, I don't think you can do one without the other.
Okay. And then Richard asked, why is electrical stimulation added to dry needling?
So the reason why I do it is it's tolerated better. So especially in big areas where maybe there's a lot of different tightness, I can like the lower back or the glute or the quad, or even the calf. Each little needle stick, it causes damage. It causes some small little damage and some small little bleeding. So I can spend 20 minutes sticking a needle in and then pulling it back out and searching for all the trigger points, or I can stick some needles, a few needles in, and then run an electrical current through it and just fatigue that muscle out and change the resting potential of the nerves in the muscle in there. And it seems to have a, a great effect even without all of the sameness. You may talk to a different therapist who's had different training than me, and they may give you a different reason, but that's why I do it.
Awesome. Awesome. So I think that's the last question we have. We covered everything, a lot of the other questions people asked in the registration. So I just want to say thank you for, again, educating us here on mobility in a lot of different areas. I know we've took you off track in a few places, but I definitely appreciate your insight. I know we learned a lot from it. Anything to leave us with here? Is there anything, like one take home message that you feel like would be beneficial for people as they get up and go on their day?
I would say the take home message needs to be that even if you feel like you have been stretching a lot, understand that you may continue to feel like that unless we address what maybe the underlying issue is. Now, I hear that sometimes they say, well, I've been stretching my hip flexors out or my hamstring out or my calf out for years and it hasn't done anything. Well, let's maybe look at some other issues that could be addressed. Let's look at some control issues, and maybe we can come back and feel like that those are and address those things, and then come back and see how you feel.
Awesome. Awesome. Yeah, well, I just want to say thanks once again, everyone, for watching today. Hope you guys have a great Monday and a great week. Make sure you reach out to David with specific questions. I will be sending the replay out tomorrow at 11 a.m. Eastern time. We have a few people from the Nashville area logging on here today. So little 10 a.m. your time. But once again, thanks, everyone. Thanks, David. I hope you guys have a great week.
Thanks, Garrett.
Talk soon. Thanks, guys.